Malaria has been described as one of the most consequential diseases of public health concern, especially in Africa. It is seen as a leading cause of death, particularly among children under age 5. Public health physicians and at the Lagos University Teaching Hospital, LUTH, gave more insight on steps individuals can take to protect themselves from malaria infections. The report.
World Malaria Day is marked annually on the 25th of April. To end malaria infection, it is essential for everyone to work together to keep proper hygiene. Speaking to Trust Television on World Malaria Day, public health physicians from the Lagos University Teaching Hospital emphasized the need for regular checkup to prevent the disease. The father emphasized the importance of taking malaria vaccine as it is available across all age groups.
The rainy seasons are upon us, and this is a time where mosquito bites are going. So the first thing to do is to reduce the risk of being bitten by mosquitoes. And one of the effective ways to do this is by sleeping in mosquito nets, insecticide-treated mosquito nets. These are proven to one of the best, protection against that. Of course, you can also use repellents and all of that. But number one way is to, reduce the risk of being bitten by, a mosquito.
Malaria has been responsible for the largest burden of malaria globally and also has a significant number of deaths. And currently, the national prevalence of malaria is at about 22%. And in some states, it's up to about 49%, like in states like Kebbi State. So it's important for all efforts to be put together to ensure that as much as possible, the burden of malaria is reduced. And so this is why every year we try to create awareness around malaria to ensure that more people are informed about it and they know what to do, how to prevent it. Currently, we have 2 malaria vaccines that have been developed. We are extremely excited about these 2 vaccines because they have been shown to be quite effective in reducing the risk of malaria, particularly among our children. So currently, these vaccines are recommended for children starting basically between 0 to 5 months. Why? Because this age group is the age group that is at risk for malaria infections, morbidity and mortality from malaria.
To effectively fight against malaria, stakeholders said it is important to seek medical attention and receive adequate treatments to avoid complications that could come from having severe malaria as a result of improper mistreatment of these infections.